Hello, everybody. Today I want to talk about surgery prep, and preparing for surgery. Now, some of you, if you're watching this, you probably have had surgery before, maybe not. Maybe you're going to have your first surgery. There's a couple of things that I want to teach you to learn from my mistakes. And one of the first things I want to tell you about is ask questions. So, this is before you're even preparing for surgery, or you're finding out that you had to have surgery, or trying to decide which surgery to have. Maybe there's something that you want fixed in your body. So make sure when you go to the doctor and they ask you if you have any questions, ask away. Ask a lot of questions. I don't care if it's a dumb question, whatever kind of question, a silly question. Just ask. Ask if you're gonna be able to eat before. Ask about the pain. Ask about the medicine, the antibiotics. Ask about the pills and everything that you're gonna have to take before and after. Also ask about the when's the next time you'll be able to work out, or how long you'll be out of school, work, or whatever the case may be, and also the healing time. So, just because you can go to school in 1 week, that doesn't necessarily mean that you're completely healed, and that the healing process may take a month, sometimes a little bit longer. And so, ask away all these questions that you gotta, even how painful it is. The doctors may give you an idea, but ultimately they really don't know. They can really go based off of the patients, but they'll tell you more or less what the patients think and say. So ask how much IV, how long you're gonna be in the hospital, who's gonna be able to pick you up, or if you have to drive yourself, whatever the case may be. So all these just every little scenario, just ask away, ask all the questions that you can ask, because there will be things that will catch you off guard. I remember having surgery, and I kind of just went. Some surgeries I just went and just did it, didn't ask nothing. And so one of them, they actually took a tooth out. I had no clue, and turns out that I didn't ask anything, so kind of caught me off guard. So another one was like, I remember I had tubes in my body for like 6 weeks or 7 weeks, and I thought that was gonna be there for a couple weeks, or at least once I got out of the hospital. I also find out when you're gonna next time you're gonna be able to eat, because you might not be able to eat the day before and a couple days after. And it's just another thing. You're gonna be asked to usually sometimes to flush out your system, meaning they're gonna make you take some medicine, and you're gonna have to poop everything out of your stomach. And so when it comes to that, if you're doing that, make sure the whole day before that you're right next to the toilet, because those stuff are strong. You're gonna be going constantly, and make sure you tell all your loved ones, your family, hey, for the day, if you can go to the restroom somewhere else, or maybe get quick when you do go to the restroom, because it's very time sensitive. And the whole day you just gotta stay by the toilet. I mean, it is what it is. And also, you might not be able to eat, so they might give you a 24-hour period or the night before. And don't make the same mistake I would do, which is like right to the last minute, I would just stuff myself with food, and that's just a terrible way to go with it. You kind of bloated, you're full, and it really don't work at the end of the day. It just is. It's more of a psychological thing. So next part I want to talk about is the psychology part of it. So some of you are kind of stressed out right now, kind of just mentally, you're not there. So the week before, you're probably gonna be thinking about it all week, and so the whole week, plan something, to do something to keep your mind off it. For some of you, so if you like to pray, meditate, work out, do these things. Stick to your normal schedule, but also like at least the day before, go and have fun. Go do something to take your mind off it. Go watch a movie, go to bowling, roller skating, whatever it is that you like to do. Have some family time, with a movie night with some friends, or whatever the case may be. If you're not the ones that don't have to like flush the whole day before, where to clean out your system, it's just the night before you can't eat. Just go out there and do something, have fun, do something with your friends to get your mind off it, because you will stress yourself out just thinking about it. So when they go and take your vital signs, you'll see that you're stressed out, and that they can kind of notice, that you're nervous. I mean, being nervous the day of is kind of normal. There's nothing you can really do about that other than calm yourself down and breathe. Breathe in and out. Just do your breathing techniques. Just do certain things to keep your mind distracted. But the whole week before, you will be thinking about it, and so you really want to plan like certain things out that are gonna keep your mind off of it. Maybe Monday, Tuesday, hang out with some friends. Wednesday, Thursday, go with the family, and maybe Friday is the day of the surgery. Do these things to keep you mentally healthy, so you're not crying the night before, the day before. I know some people. I've seen people like really stress themselves out, where they start crying. They don't know how to handle themselves, and you see some they just shut down, and you see some that are just kind of, they kind of try to compensate for it, where it's like they try to psych themselves out. That's not really the way to go. I used to do that, and it just didn't really work. The whole thing that I had to learn to do was really just to relax, meditate. I would go in my prayer. I just pray to God, and then I would just do things to kind of like have fun, or just to keep my mind off of it. So I would enjoy working out, work out, and I'll keep that week a whole busy week. So by the time the day of the surgery came in, I just didn't even notice it. I didn't think about it. So that whole week of, just keep it jam packed with things to do, where you tire yourself out, so you can even you don't at night you don't even have time to think about it. You just knock out up in the morning, and then you got more things to do. So keep it, nice and busy, and also make sure, obviously, that you're making the right preparations for the surgery. So whatever the doctor recommends, you do these things. And so that's kind of all I have. Just make sure, don't stuff yourself before you have to eat. Whatever your time period is. Make sure you're mentally okay. That you keep yourself busy, and then do all these little, ask all these little questions that the doctor, whatever questions you may have, because you don't know what might come up. There's some things, the doctors just miss, and there's some things that you really don't think about. So ask away. There's no dumb questions. You know, relax. You're gonna be fine. And I just thank you for watching this video. Bye.